If the current health commissioner gets his way, Virginia will see mandatory COVID-19 vaccinations when they are available. Is this what states run by Democrats can expect, or will there be others? We'll look at this topic in this episode of Analysis Behind the News, where we provide the perspective that you can use to restore American liberty and independence. Last week, Virginia State Health Commissioner Dr. Norman Oliver responded in the affirmative to an ABC 8 News' reporter's question about mandating a COVID-19 vaccine if he is still in office when one is available. He specifically said, "It is killing people now. We don't have a treatment for it, and if we develop a vaccine that can prevent it from spreading in the community, we will save hundreds and hundreds of lives." He also said, "We would not launch a campaign around mass vaccination with anything that hasn't proven to be safe." Two major issues with those statements. One, the claim that there isn't a treatment for COVID-19 when there actually is. Doctors have seen good results from an inhaled steroid based on the work by Dr. Richard Bartlett. Plus, many more doctors have seen great results from hydroxychloroquine. The second issue is that they wouldn't launch a mass vaccination campaign unless it was safe. Really? Tell that to the 4,000 Americans who took the swine flu vaccine in 1976 and ended up either dying from it or getting neurological damage. According to a 60 Minutes expose, they reported,
"Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer that could spread across the nation. And Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic. Well, 46 million of us obediently took the shot. And now 4,000 Americans are claiming damages from Uncle Sam amounting to $3.5 billion because of what happened when they took that shot. By far the greatest number of the claims, 2/3 of them, are for neurological damage or even death, allegedly triggered by the flu shot."
Today, the U.S. Department of Health and Human Services almost breaks its arm patting itself on the back in regards to how safe vaccines are in this country. It wrote, "The United States has the safest, most effective vaccine supply in history. In the majority of cases, vaccines cause no side effects. However, they can occur, as with any medication, but most are mild. Very rarely, people experience more serious side effects like allergic reactions. In those instances, the National Vaccine Injury Compensation Program, the VICP, allows individuals to file a petition for compensation." This was written on the latest National Vaccine Injury Compensation Program data report. That's right, the U.S. vaccination program is so safe that it has its own vaccine court to handle the thousands of claims brought to it. The latest report states, since 1988, over 22,130 petitions have been filed with the National Vaccine Injury Compensation Program, VICP. Over that 30-year time period, 19,114 petitions have been adjudicated, with 7,477 of those determined to be compensable, while 11,637 were dismissed. Total compensation paid over the life of the program is approximately $4.4 billion. Notice that half of these claims were dismissed by the court for some reason. Also, some may want to point out that these injuries occurred out of more than 4 billion doses of vaccines administered in this time period. So the odds are pretty low of being injured until it's your child that's harmed. Then the odds really don't make much difference, do they? You should never be forced to gamble with your child's life. Rather, parents must retain the right to choose any medical procedures for their children without the force of the state. So can we trust Dr. Fauci, the director of the National Institute of Allergy and Infectious Diseases, who has advocated for a COVID-19 vaccine? Not according to Dr. Harvey Risch, an epidemiology professor from Yale. He said on the Mark Levin show earlier this week, the FDA has relied on Dr. Fauci and his NIH advisory groups to make the statements saying that there is no benefit in using hydroxychloroquine in outpatients. And this is counter to the facts of the case. The evidence is overwhelming. Dr. Fauci and the FDA are doing the same thing that was done in 1987, and that's led to the deaths of hundreds of thousands of Americans that could have been saved by the usage of this drug. Not to mention that hard-left globalist organizations around the world are pushing vaccines by setting up a false dichotomy. The World Health Organization states right on its website, there is no time to waste in the fight against COVID-19. No one is safe until everyone is safe. But let's remember that COVID-19 has a 98 to 99% survival rate, which means nearly everyone is already safe. So why the scare tactics? Because, folks, it's not about health. The documentary Plandemic and Plandemic 2 makes it abundantly clear that safety and health are not priorities, but money and control are. Case in point, the World Health Organization is run by a Dr. Tedros, who is not a medical doctor. Rather, we might call him a terrorist from Ethiopia, who managed to get his WHO appointment due to great pressure by China. The faux Dr. Tedros made the statement earlier in the month of August, we need to prevent COVID-19 vaccine nationalism. For this reason, WHO is working with governments and the private sector through the Access to COVID-19 tools, otherwise known as ACT-Accelerator, to ensure that new innovations are available to everyone, everywhere, starting with those at highest risk. This ACT-Accelerator is a global collaborative effort to, as the WHO website puts it, to accelerate development, production, and equitable access to COVID-19 tests, treatments, and vaccines. The site also lists the organizations behind this initiative, which include the Bill and Melinda Gates Foundation, CEPI, FIND, Gavi, the Global Fund, Unitaid, Wellcome, the WHO, the World Bank, and Global Financing Facility. These look to be left of center, globalist organizations tied in with the United Nations infrastructure of world government bodies. Even the Director of Vaccine Development at CEPI, which is the Coalition for Epidemic Preparedness Innovations, suggests that COVID-19 and the seasonal flu is not dissimilar. She suggests we manage it, meaning seasonal flu, well globally through vaccination, which is extremely successful at preventing morbidity and mortality in the elderly and high-risk populations, even though in the elderly, vaccines are not 100% protective. They manage it well, she says. According to the CDC, last year's flu effectiveness was a dismal 29%. Plus, if the seasonal flu and COVID-19 are not dissimilar, why does everyone need to get it when it's the elderly and high-risk populations that benefit the most from a vaccine? And by the way, according to its website, the Coalition for Epidemic Preparedness Innovations was founded in Davos by the governments of Norway and India, the Bill and Melinda Gates Foundation, the Wellcome Trust, and the World Economic Forum. None of these organizations have your best interest in mind. Now, each of you will personally need to wrestle with this and about what you're going to do. This should be a choice that you make with your doctor. You certainly don't need a government entity forcing it upon you. While Democrats have a propensity to push this, the COVID-19 virus lockdowns have shown us that Republicans are not immune to using tyranny. So regardless of which political party is in control, you have some work to do. As we have said many times in previous videos, when tyranny arrives on your doorstep, the only tool that absolutely works and has been working for millions of Americans during these trying last 6 months is nullification. This occurs when a local authority stands up for the rights of those to whom he or she serves. Sheriffs, mayors, county boards, district attorneys, and others have decided not to enforce such draconian measures as business and church lockdowns, mask mandates, and social distancing requirements, none of which are laws, rather edicts from individuals. This is why it is so important to get to know these authorities and to get educational material to them to help guide their actions when times for mandatory vaccinations come forth. We have several tools that you can use to pass along to these authorities in your area, including the Forced Vaccines and Digital IDs reprint from the New American Magazine, which points out many of the deep state players in the health industry, plus the Dissenting from the Panic Attack issue of the New American Magazine that covers the growing body of scientists and medical professionals that are beginning to expose the mainstream fear-mongering over coronavirus. Pass these along to local authorities and then publicly display your support for freedom with our Freedom is the Cure bumper stickers, yard signs, and banners for community events. Get others involved to avoid mandates before they happen or to legally act when they do happen. Who do you know that cares about the health of children as well as our freedom and independence? Links are in the video description. I'm Bill Hahn from the John Birch Society, and until next time, stay informed, stay active, and stay safe, Patriots.